Welcome to UMC's Emergency Center. We know that you and your family would never choose to be in an emergency situation, but now that you are here, our team at UMC will give you and your loved ones the best care possible. When you came into the Emergency Center, we placed you on one of 3 different patient tracks. The fast track is for patients with minor complaints that should be relatively quick to diagnose and move towards discharge. The pediatric track is for our patients from newborn to 15 years of age. We have specialists in treating children who are here around the clock. The last track is the physician track. This is for patients who need to see a doctor here in the emergency center. You may have a longer wait than patients in the other 2 tracks because we need to ensure that you are seeing the right provider who can meet your needs. So, if you see someone in the waiting room that seems as if they might be going in ahead of you, they may be on a different or less emergent track than you. After you have checked in, we will call you to complete the registration process, so please listen for your name to be called by a registration staff member. We have a few forms that you'll need to fill out in order for us to provide care, and to protect your privacy, we will give you this information in a different area. While we're talking about waiting, please know that we cannot give you an exact wait time or where you might be in a waiting list of patients. This waiting list really does not exist as our patients are seen based on their emergency need and not really by the order in which they arrived. We also ask that as a patient waiting in the lobby, please do not eat or drink anything until you have seen a provider, as this can lengthen your stay in the emergency center. While you're waiting, if you begin to feel worse, please do not hesitate to talk to the nurse that will be rounding in the lobby throughout the day. Or, if that nurse is not rounding at the time, please find them in the second cubicle at the front desk. We want you to be as comfortable as possible while you wait. So if we can do anything to make you more comfortable, from changing a channel to providing a magazine or getting you a blanket, please let us know. Now that you're in a room, here are a few things to expect as we take the next step in your care. As a patient, you may be asked to change out of your clothes and into a gown so that our providers can properly assess you. Your nurse will introduce themselves and fill out the communication board in your room with the names of your primary care team and other information specific to you. Our communication boards provide a place to update you and your family on the care you are receiving. If you are being admitted to the hospital, you may have an extended wait time as we find you a room at UMC. We apologize for any lengthy wait you may have, but we will keep you informed and up to date on how your admission is progressing. As our staff interacts with you, feel free to ask questions on how long things will take, as we want you to stay informed while you are here. In general, labs may take around 45 minutes to 1 hour for results, and any radiology exam, like X-rays or MRI, will usually take 1 to 2 hours. Once you are settled, your physician will see you in your room, and once your care has begun, they will see you again to let you know the results of any tests that they have ordered. Our goal is that every hour, a staff member will be in your room to round on your condition. However, things can get busy and this length of time can get longer. If it has been 2 hours since a staff member has been in your room, please let us know. While in your room, if you have an immediate need that cannot wait until a staff member rounds on you, just press your patient call button and one of us will be right with you. Finally, we will keep your door closed for your privacy, but if you would like it left open, please just let us know. After your healthcare provider has discussed with you everything that was found during your examinations and testing, you will decide together what the next step in your care will be, whether that is to be admitted to the hospital, to seek additional physician consults, or to discharge from the emergency center. If you're being admitted to the hospital, you may have an extended wait time as we find you a room at UMC. We apologize for any lengthy wait you may have, but we will keep you informed and up to date on how your admission is progressing. If you are discharged home, Your nurse will bring you your discharge paperwork. They will go over your diagnosis from your physicians and what you should expect when you leave the emergency center. We will also discuss any medications that are being prescribed to you, and we will explain what the medications are for and how often you will need to take them. And before you leave, both your doctor and your nurse will address your pain before you move to the next step in your care. After you leave, if you have concerns or questions about your orders, medication, or symptoms, please feel free to call our free 24-hour helpline at 74-NURSE. This service is staffed by UMC nurses, and they can answer any questions or concerns that you might have. So if you need us, please call 74-NURSE. Finally, once you are home, you may receive a survey about your care here in the emergency center. Please take the time to answer this survey and let us know how we are doing and how we can improve for the next patient. We know that no one chooses to have an emergency, and we thank you for trusting us with your care here at UMC.